Today, the state reported for the first time that ICU availability in the San Joaquin Valley region has fallen to 0%. That's a quick drop from 19% a little over a week ago. Our Medeiros Babb is live at community medical centers in Fresno with more from a doctor on the front lines. Medeiros.
Shauna, when I spoke with Christina Mazer today, who is a UCSF professor and a Fresno surgeon, she says that no matter what, the hospitals will continue to make room, especially for those in need of urgent care. But others across the valley worry that if we do not change our behavior, things will continue to get worse.
We're healthcare. We just rise to the challenge. You go until you can't go. And I think that how can we sustain things? We'll do everything possible.
Another grim milestone, according to California's COVID website. The San Joaquin Valley has hit 0% available ICU capacity, the only region in the state with less than 5% of ICU beds open. Staffing, the biggest concern for hospitals as more and more healthcare workers in quarantine.
It crosses the gamut, and that's really where the fatigue is really starting to set in, is that you look around you and your colleagues are getting sick every day.
359 of community medical center staff in self-isolation, with 195 staff COVID positive. In the South Valley, 190 Kauai Delta staff at home after being exposed to the virus. 90 of them are frontline workers. The chief nursing officer says without a change in the community's behavior or more staff from the state, things won't get better.
We have had to plan, in essence, for the worst possible scenario. I projected that worst possible scenario to be maybe 10 days from now, and it's probably reach it before that 10 days, and then it'll continue to worsen.
The positive news, hundreds of thousands of doses of the Pfizer vaccine on their way to California, which Governor Gavin Newsom said in a tweet could be shipped to counties as soon as Sunday. But UCSF professor and surgeon Christina Mazer says we will not see the effects of the vaccine for months.
It's not over. It's not going to be over for a few months. And I just really would ask that everybody be very aware of everything they're doing.
And Mazer hopes that people start thinking of these healthcare workers not as the front line, but really the last line of defense. And she says the true front line is our preventative actions every day, but like not going to gatherings, wearing a mask, and staying 6 feet apart. Reporting live from downtown Fresno, Medeiros Babb, Ksee 24, local news that matters.